My name is Dr. Adam Farber, and I would like to talk today about rotator cuff tendonitis or impingement syndrome. In order to understand rotator cuff tendonitis, you must first understand normal shoulder anatomy. The shoulder is a ball and socket joint with a socket, also known as the glenoid, is part of the shoulder blade. The ball, also known as the humeral head, is part of the upper arm bone or humerus. If you view the shoulder blade from the back, you can see a ridge of bone coming off of the shoulder blade that passes over the top of the ball and connects to the collarbone in the front of the shoulder. The rotator cuff is a series of 4 muscles that surround the shoulder blade and attach to the ball of the ball and socket joint. There is one muscle in the front called the subscapularis, one on top called the supraspinatus, and 2 in the back named the infraspinatus and teres minor. These muscles pass over the ball much like the cuff of a shirt sleeve would pass over your wrist, and this is where the name rotator cuff comes from. If you remove the ball and look at the rotator cuff and shoulder blade from the side, you can see how these muscles and tendons form a cuff like the cuff of a shirt sleeve. As I previously mentioned, the rotator cuff passes beneath the arch of bone on the shoulder blade and attaches to the ball of the ball and socket joint. Between the rotator cuff and the arch of bone is a soft tissue structure called the bursa. This is a cross-sectional view of the shoulder in which you can see the ball, socket, rotator cuff, bursa, and overlying arch of bone. If you remove the ball and look at the socket from the side, you can see clearly the flat arch of bone over the top of the rotator cuff. Normally this arch of bone is flat, but occasionally this bone can become curved or hooked. This curved or hooked shape can pinch the rotator cuff and bursa and cause shoulder pain. The term impingement syndrome refers to the pinching of the rotator cuff and bursa between the arch of bone overlying the rotator cuff and the ball from the ball and socket joint. This can create a thickened and inflamed bursa, which is a source of shoulder pain. Impingement syndrome typically results in pain on the upper outer aspect of the shoulder and arm in the area depicted in red. This pain is typically aggravated by reaching, lifting, and performing overhead arm activities. This pain is often worse at night, and patients frequently report difficulty sleeping. Treatment for impingement syndrome typically starts with a conservative, non-operative approach with rest, ice, anti-inflammatory medications, cortisone injections into the inflamed bursa, and a course of physical therapy. If these treatment measures fail, arthroscopic surgery is recommended to remove the inflamed bursa and flatten out any bone spurs that may be present, contributing to the impingement process. If necessary, surgery is performed arthroscopically with 3 small, 1 cm minimally invasive incisions. The surgery is performed on an outpatient basis, meaning that you do not require an overnight stay in the hospital. The surgery typically takes less than 1 hour to perform. This is a photograph displaying the setup for arthroscopic shoulder surgery with a small camera placed inside the shoulder joint through a small incision on the side, and a shaving device placed through a similar small incision in the back of the shoulder. The shaving device is used to flatten out any prominent bone spurs, such as the hook we previously discussed. This is a photograph taken in the operating room showing the bone before and after the hook is removed along the red dotted line. For further information about impingement syndrome, please feel free to contact my office at 480-219-3342 or visit my website at phoenixshoulderandknee.com.